going to discuss the decision-making framework. This begins with what the person understands and helps identify gaps in understanding. It's a series of exploratory questions. It provides information on benefits and burdens to improve understanding. It helps people talk about what goals they have and what outcomes are acceptable or unacceptable. It may uncover fears and concerns about making a decision. In summary, the decision-making framework promotes person-centered decision-making. Why is the CPR exploration important? This is a common question that people are asked whenever they are admitted to different types of facilities, from a hospital to long-term care. There are misperceptions of the treatment outcomes for CPR. It may help identify questions to discuss with the individual's physician. It may also help the individual have time to make an informed decision. We will use the CPR decision as an example of how to use the decision-making framework. By now, I hope you've had time to view the CPR conversation video. If you'd like to view it again, following along with the blue conversation guide, question number 9, and the CPR fact sheet, it might help you become more comfortable with this conversation. Some of the skills that I hope you observed include use of the decision-making framework, use of communication skills to promote conversation and understanding of goals, and use of the CPR fact sheet to deliver information in an unbiased manner. You may have noticed in the video that Kevin asked permission before he shared that CPR fact sheet with the couple. It was also demonstrated in the video the facilitator using the decision-making framework throughout this conversation. He did not simply ask, "Do you want CPR if your heart stops?" This conversation may often identify questions to take back to the physician for more discussion. You can take notes during the conversation of a list of questions that the person may identify as you're moving through the conversation. Emphasize the value of the conversation, not just the CPR decision. Now I would like you to look at these statistics regarding CPR in hospitalized patients and CPR in long-term care facilities. These are statistics related to the outcomes for those patients. I'm curious what your reactions are to this information. While it is factual, it is often surprising to most individuals. When you're having this conversation, you need to avoid communicating any personal biases or using any value-laden words and phrases. I'd like you to think back to the 5th promise that was discussed earlier in this course. The ultimate promise is focused on honoring preferences and decisions. As an ACP facilitator, we assist in transferring the individual's goals, values, and decisions to a written plan. We recognize common problems with written plans, and we help document the individual's goals of care for the Imagine This scenario. Again, I can't emphasize enough, it's important for these conversations to be had because everything cannot be documented on a piece of paper. There's no document that could possibly hold every scenario or every possibility that might happen. But if the conversations are had and an agent or healthcare representative is identified, this person can speak for that patient when they can't speak for themselves. Some of the common problems that we see with written plans include technical errors, incomplete contact information, signatures that are missing, or witnessing criteria that isn't met. In Indiana, usually facilities will let you know who can witness. We don't have the kind of restrictions that some other states do. There are ambiguous statements, such as on the slide, "Don't use any tubes to keep me alive," Well, we need to identify what that means for that patient. So we don't want that kind of language on a document. And lack of specific planning. An individual who wants to avoid the nursing home but has no contingency plans, that's not going to be helpful on a document for anyone who is trying to carry out that patient's wishes. So our goal is to help them create a clear and accurate written plan that aligns with promise number 3, which is we will make sure that plans are clear. Let's return to Matthew's advanced care planning conversation. In looking at his goals, how could they be documented on a written plan? He wanted to have a good chance of recovering his ability to know who he was and who he was with, and he defined this as greater than 50%. If you'll recall, less than 5% is unacceptable to Matthew. He also wanted to stop medical treatment if there was less than a 50% chance. Let's talk about a lot of forms in the state of Indiana and other states do not provide this level of clarity. The individual can add these specific preferences, but how would you document that? Here is one example of how Matthew's goals could be transferred to a written plan. There may not be room for this type of information on the state form that you're using. There is a small space on the Indiana form. However, you can add additional documents, and again here I will emphasize the importance of the conversation. If Matthew's healthcare representative understands the kind of care that he wants to receive and understands his 50% chance indication, they will be able to help direct his care whenever Matthew cannot direct it himself. You can find some more information about this in the Facilitator Handbook. Before I let you go, I want to suggest that you become familiar with the plans in the state where you're going to work. I anticipate that a lot of you will be working in Indiana. Just know that the legislature is working on updating some of the forms, but as you probably are familiar, that is a very slow process. I highly recommend the Indiana Healthcare Representative appointment. If you've had this conversation with someone, they can appoint officially through the state of Indiana their person who is going to be their healthcare representative. We call it a healthcare agent in a lot of this training, but agent, representative, that's what we're talking about. It's the same thing. There are some other documents that you can use and some other tools. Prepare for Your Care, the Conversation Project. There are several items that you can use to help people document this. I know some of the facilities throughout the state used 5 wishes. You need to understand that 5 wishes is not recognized by the state of Indiana yet. It's recognized in 22 other states, but not in Indiana yet. So just keep that in mind. If patients or family members have documents already prepared, you can look at those documents with them and try to determine, does it come across the way they need it to come across? Does it provide the information that a healthcare provider would need to care for this person? Or do they need to identify someone who can speak for them when they can't speak for themselves? So again, I highly recommend the Indiana Healthcare Representative appointment. And if you have any questions about these documents, we'd be happy to discuss.